health care.
We're still fully committed to pushing through with the Senate, but we're looking at every possible option of repealing and replacing Obamacare.
But after a week of closed-door negotiations, no revised bill for senators to consider as they head home. But a few new proposals are appealing to some GOP health care holdouts. Now on the table for moderates, a possible sweetener of up to $45 billion to fight the opioid epidemic and an option to keep an Obamacare tax on wealthy investors. On the other end of the spectrum, some conservatives are pushing a proposal to allow insurance companies to offer cheaper plans that do not cover essential health benefits.
It's a big, complicated subject. We've got a lot of discussions going on, and we're still optimistic we're going to get there.
The president also tweeting another idea Friday morning, suggesting senators immediately repeal Obamacare, then come up with a replacement at a later date. Senators Rand Paul and Ben Sasse tweeting back their support of that idea. But Republican Congressman Adam Kinzinger of Illinois, appearing on CNN, said that's not the way to go.
No, I think it's repeal and replace. I think we have to have a good system for the American people to come in.
And that was Emily Rao reporting. Let's discuss all of this with Sarah Badawi. She's a Democratic strategist and senior lobbyist for the Progressive Change Campaign Committee. And Peter Pitts, he joins us in studio. He's a former FDA Associate Commissioner and President of the Center for Medicine in the Public Interest. Peter, is it a wise idea to repeal immediately and try to replace it later?
Absolutely not. I mean, you need to do things step by step, and the problem is we're looking for fast, simple solutions to a very complex problem. We've got to step back and realize that trying to pass a bill that's small so that it can pass on 51 votes isn't going to solve a huge problem. We need a bigger bill with bipartisan participation so we can really address the large problems that we need to solve.
And Sarah, you'd agree, therefore, that President Trump handed Democrats essentially another gift by messing up the Republican negotiations with this idea of repealing first and replacing later.
Yes, I agree with Peter. Repealing first without a replacement is basically seeing someone drowning and throwing them a bucket of water. It's the completely wrong direction.
You say that the idea is to put a bigger bill that will get bipartisan support. Now that sounds, of course, like the ideal. How would that happen in practical terms?
Well, practical terms, I think we have to have a big gulp of wine and take a step back and try to dial down the politics. Good luck with that, right? But I think, believe it or not, when you take a page from Bernie Sanders' playbook, I can't believe I'm saying that.
Wow.
You know, he talks a lot about a Medicare for all proposition, let everybody buy into Medicare if they want to. And I think that's foolish. I think it would fail, but I'm pragmatic, let's go for it. But if you're gonna do that, you need to allow insurance companies to sell their insurance premiums and programs across state lines. Let them compete. And I'm sure that when the government competes against the private insurance industry, it's gonna come in third, fourth, fifth, last place.
In other words, the idea being that everyone has Medicare, and if somebody wants to buy additional coverage, comprehensive coverage, they can do that. You would give some flexibility to conservatives. The Democrats and progressives, Sarah, they would get to universal coverage. Is it a wise idea?
Sure. I mean, that's certainly in a more progressive direction. But let's be clear. At its core, Republicans are trying to repeal the Affordable Care Act, which would take health insurance from over 20 million people, all to pay for a tax cut for the rich. So if we're having a conversation about how you keep the Affordable Care Act and attempt to fix it, the floor is definitely something like a public option or a Medicare buy-in that would make the markets more competitive and give people a more affordable option in the mix.
Sarah, I totally get your point, but on the, and we'll get to the whole idea of, you know, whether the Affordable Care Act or not, but assuming that the affordable, let me make it clear, wouldn't Democrats love to have universal coverage, whether it's Medicare for all, Medicaid for all? Isn't that something that Democrats ultimately want?
Absolutely. If it moves us in the direction of a single payer with Medicare for all, that is where we should be looking. But by no means does that mean we have to dismantle the Affordable Care Act to do it. We can improve upon it before we strip health care from tens of millions of people, hoping we'll get there.
Peter, we see you shaking your head.
I'm sorry. Those are political talking points that don't hold any water. The fact is that Obamacare was designed to fail by people that wanted us to move towards a single-payer system. And I want to make it clear, by no means am I supporting a single-payer system. It's a bad idea. It doesn't work anywhere on earth. What I'm talking about is if the government wants to provide a foundational healthcare system that people can buy into across state lines, let the private industry compete on an equal basis. When, you know, right now,
like they have in France. Right now, they have a hybrid system in France that at least the French seem to like.
That's right, and the largest growing sector of the British healthcare system is private insurance. So when we say we want healthcare like in Europe. First of all, there is no European system. And secondly, many European systems are recognizing the value of a hybrid proposition. But that's a hard thing to tell people who want simple solutions to complex problems.
Well, it's a pretty simple solution to add a public option or a Medicare buy-in to the existing exchanges, and that would make the market more competitive for everyone. So if we're talking about fixing the Affordable Care Act, I think the floor of the conversation that we should be having is something like a public option.
But how does throwing in a public option while not allowing insurance companies to sell programs across state lines make things more fair? It makes things less balanced. It exacerbates the problems that the Affordable Care Act has brought in by sucking competitiveness out of the healthcare market. That's the basic problem with Obamacare. It doesn't reward smart, competitive programs.
Sarah, you want to respond?
Well, I think Sure. I think the problem here is we're assuming that these health insurance companies are good actors, when really what we're giving them license to do is discriminate against consumers and also result not only in many people being uninsured, but also now saying underinsured is okay, because we're going to take away the mandate that says people need to have insurance, but also we're going to allow them to sell a lower quality product. So I think we need to keep the protections of the Affordable Care Act in place and figure out how we create a Medicare buy-in that keeps these companies honest.
Oh, that's simply denying reality. Obamacare created policies that are low cost and don't provide coverage.
But Peter, why removing the mandate? Why is that a good idea? Because people that don't have health insurance, maybe they need the push to get it. Maybe there should be a fine if you don't play along. Why is that not a good idea?
Well, I think the goal here is to get healthy young people into the insurance pool. Because if you have insurance pools that don't have healthy young people, it doesn't work. That's what insurance means. And whether you try to tax them into it or whether you try to incentivize into them, I don't think we found the solution. I think it's probably, again, a hybrid of the two. You have to change the rules. You have to make the penalties much bigger, or you have to create much greater incentives to get people into the system. We've tried the stick. Now we need the carrot.
And speaking of carrots, Sarah, Mitch McConnell has said that if Republicans are unable to pass this bill on their own, which it looks like they won't be able to, he would then go to Chuck Schumer and the Democrats and say, okay, let's try to fix the individual markets, keep the main elements of Obamacare, but make the changes that even some Democrats say privately need to be made. You would support that, wouldn't you?
Well, no, I think the point here is that we need to be doing everything we can to protect the Affordable Care Act. And it's not just Democrats like me or members of Congress saying this. We're talking about millions of Americans calling their representatives, talking about the stakes of repealing the Affordable Care Act. This is more than just numbers. These are real people on Medicaid, real seniors that would stand to lose affordable Medicare Advantage programs. We're talking about real lives that are calling in to these members of Congress and saying, don't do this.
But Sarah,
so
to
the
my question.
conversation that Chuck Schumer...
To my question.
Right, so the well, the floor for any Democratic negotiation would be a public option, and I just don't think Republicans are going to play ball there. So any bipartisan attempt here isn't going to work.
If a public option is at the foundation of Democratic proposals, why haven't they been talking about it? The only person I've heard talking about it is Bernie Sanders.
Well, no, I would say Elizabeth Warren's also been talking about it, and 33 senators supported the idea for a public option last summer when Aetna screwed over the exchanges in several states. So it is alive and well.
The exchanges that were losing money, those exchanges?
Well, Aetna decided to pull out, and there was nothing in the market to help keep them competitive. So if we had a public option, it would be more competitive.
Well, yeah, it sounds like protecting Obamacare is like going to the kitchen of the Titanic to protect the ice sculpture in the dining room.
Right, but the Titanic is going to sink even faster, according to the CBO, if you go with the Republican proposal, which would cause premiums to go 20% higher than Obamacare is supposed to go over the next 2 years.
Right now, the Affordable Care Act premiums are going to go skyrocketing if we leave it in place. That's why we all need to step back and say, listen, how can we work together to address this problem in a holistic way rather than trying to score political points one way or the other? And Chuck Schumer, who's my senator, is the emperor of scoring talking points. That's got to stop.
All right, Peter Pitts and Sarah Badawi, thank you both for joining us. We appreciate the conversation.
Thank you.
Thank you.
Still to come, a major